For my IRB proposal, I chose to study the effects of vitamin C on wound healing. Pressure ulcers, sometimes referred to as bed sores, are injuries to the skin and tissues resulting from prolonged pressure on the skin. Constant pressure on any part of the body can lessen blood flow to that area, depriving it of oxygen and other nutrients. As a result, the skin breaks down and produces a pressure ulcer. The rate of acquired pressure ulcers continues to rise rapidly, despite its preventability. Incidences of pressure ulcers have been shown to increase by as much as 80% between 1995 and 2008. One study performed in Japan showed pressure ulcers are one of the most urgent issues in hospitals today. Common areas for pressure ulcers are the tailbone, buttocks, shoulder blades, spine, back of the arms and legs, hips, lower back, heels, and ankles. People that are at most risk for pressure ulcers are those with medical conditions that limit their ability to change positions. In addition, poor nutrition and hydration can lead to the development of a pressure ulcer. Before I turn to the next slide, I do want to warn you all there is sensitive content on the next slide. So if you have a sensitive stomach, you may want to look away. Pressure ulcers are staged based off the sensitivity and severity. Stages are 1 through 4 and sometimes considered unstageable. Stage 1 is intact skin, but is an area of localized non-blanchable skin. Stage 2 is characterized as partial thickness skin loss, where the wound bed is visible. Stage 3 is noted to be full thickness skin loss, where adipose tissue is visible. And Stage 4 is characterized by full thickness skin loss, where cartilage or bone is visible. Unstageable pressure ulcers are those that are obscured by slough or eschar, but should be treated like a stage 4 pressure ulcer, since slough or eschar is only present in a stage 3 or 4 pressure ulcer. On the slide depicts a pressure of each stage. Because your body does not produce vitamin C, you need to obtain it from your diet, making it an essential vitamin. Vitamin C, also known as L-ascorbic acid, is a water-soluble vitamin that is naturally present in some foods and added to others. The foods richest in vitamin C include citrus fruits, green peppers, strawberries, tomatoes, broccoli, white potatoes, and sweet potatoes. In addition, some foods and beverages are fortified with vitamin C. Because vitamin C is an essential vitamin, deficiencies can happen but are rare. A vitamin C deficiency can lead to scurvy, rarely seen in developed countries. Initial symptoms of scurvy include fatigue and inflammation of the gums. Signs of scurvy can start to appear within 1 month and can lead to death if left untreated. Just like deficiencies of vitamin C, toxicities are rare. Vitamin C is not believed to cause serious adverse side effects at high intakes. Common complaints of high doses of vitamin C are diarrhea, nausea, abdominal cramps, and other gastrointestinal disturbances due to the osmotic effect. The most common role of vitamin C includes aiding in the absorption of iron, maintaining cartilage, bone, and teeth, and it is considered an antioxidant. Antioxidants are nutrients that prevent damage from free radicals. Vitamin C has been advertised as being a popular remedy for the common cold, but contrary to popular belief, research shows that for most people, vitamin C supplements or vitamin C-rich foods do not reduce the risk of getting the common cold. Vitamin C aids in wound healing because it is a cofactor for a variety of enzymes that are necessary for the biosynthesis of collagen. It acts as a cofactor for non-heme iron. Such enzymes are responsible for stabilizing and cross-linking the collagen molecules, meaning this process makes the collagen stronger, thus making your skin stronger. Another way vitamin C influences collagen synthesis is by stimulating lipid peroxidation. This product of this process, in turn, stimulates collagen gene expression. The third way vitamin C aids in wound healing is it directly activates transcription of collagen synthesis and stabilizing procollagen mRNA, thereby regulating collagen synthesis. So far, there have only been 2 relevant studies examining the role of vitamin C in wound healing. The study done by Taylor and Associates carried out a double-blind, randomized controlled trial with 20 post-op patients with pressure ulcers. Half the patients received 500 milligrams of ascorbic acid twice daily for 4 weeks. The other received a placebo. At the end of the study, patients receiving the treatment had significant improvement in the surface area of their pressure ulcers by 84%, while the placebo had a reduction of 42.7% on average. In contrast, a study published by Terret, Kessels, and Knipschild concluded that there were no statistically significant differences in healing rates of pressure ulcers between a control group and a group receiving 500 milligrams of ascorbic acid twice daily for 12 weeks. Although there seems to be contrasting studies done, there is hopeful evidence that suggests vitamin C is beneficial and essential for wound healing. My questions for further studies are: first, how much vitamin C is recommended to promote wound healing? This research will help with producing vitamin C recommendations based off of each pressure ulcer stage. For example, how much vitamin C is recommended for a stage 2 pressure ulcer versus a stage 4 pressure ulcer. In addition, it will help understand how long it should be prescribed. Second, is vitamin C truly needed for wound healing? More so, is vitamin C really needed for wound healing, or are other interventions more effective? Subjects will consist of long-term care residents of a nursing home that have pressure injuries. 385 subjects with pressure injuries will be subject to this project. Subjects will be randomly picked, ensuring they have qualifying pressure injuries that have potential for wound healing. Pressure ulcers that have potential for wound healing will be determined by a qualifying physician. Terminally ill or actively dying subjects will be excluded. This will also be determined by a doctor. A randomized, double-blind study will be performed. 385 subjects that are long-term care residents of a nursing home with pressure ulcers will be studied for 1 month. Half of the subjects will be randomly assigned to ingest 1,000 milligrams of ascorbic acid, and the other half will receive the placebo. The trial group receiving the intervention will be given 500 milligrams of ascorbic acid twice daily for 1 month. The pressure injuries of every subject will be measured daily using a ruler and a cotton-tipped applicator if they require a depth measurement. Measurements will be taken by a trained professional daily for 1 month. A tracking tool will be used to track the measurements of each subject's wounds. At the end of 1 month, the wound measurements will be evaluated. The initial measurements will be compared to the final measurements. We will then determine if there was improvement in the size of the pressure injury based off the measurements taken. Only then will the researchers be informed of which subject received the ascorbic acid or the placebo to determine if the ascorbic acid had any effect on pressure injury size. The data will be considered statistically significant if p-value was less than 0.005. If most of the pressure injuries are statistically significant, then we can reject the null hypothesis, which is vitamin C has no effect on pressure injury healing, and determine vitamin C is needed in the treatment of pressure injuries. Again, therefore, before we move on, there is sensitive material on the next slide. Materials and devices used will include the intervention, 1,000 milligrams of ascorbic acid, or the placebo. Also included will be anything the subject needs to take the intervention, for example, cups and water. In addition, measuring materials will be needed. Measuring materials include a ruler and cotton tip applicator to measure the width, depth, and length of the pressure injury. Also needed are pressure injury coverings like bandages to prevent infection and worsening of the wound. Risks of the study include worsening of the pressure ulcer due to no other intervention being applied to the wound, since vitamin C alone is being studied as an intervention. Risks toward the researchers include legal harm. Participants may want to take legal action against the study if the result ends in worsening wounds. Benefits of the study include improvement and potential healing of pressure ulcers to the participants at no cost. In addition, if the intervention is found to be beneficial, this can be communicated to all clinical settings and it's as an intervention for wound care. I expect vitamin C will be an important part of wound healing based on the literature that has been studied before. I do not expect it can act alone as a means for wound healing. It must be used in conjunction with proper nutrition, hydration, and pressure reduction to the specific area. I feel vitamin C will be most effective when given at 500 milligrams twice daily. And this slide shows references that was used during this presentation.